20-25 minutes is to cover some basic information regarding COVID overall, as well as the relationship to sports and recreation. And then mostly importantly is to listen to the questions that you have and to answer as best we can. And if similar to other presentations, we don't know the answer, we'll find it and get it out to you. So really the intent is to discuss COVID in the context of recreation and recreational facilities and sports teams, and to review strategies for safer reopening and return to play. That's really what this is about. Contextually, as we reopen, and of course, with opening of facilities and more opportunities for athletes to participate in stage 3, this is really our attempt to balance the risks of COVID with trying to have as normal as possible an experience in living with COVID going forward. Recognizing that the social and economic networks that we have are very important for our overall health. The caveat here, of course, is that the more interactions that there are in our society, the increased risk of transmission there is. And so we're needing to temper our desire to do everything that we used to do with how to do it as safely as possible. There's no such thing as a zero risk here, but we're trying to reach a balance to be able to do things and to do it as safely as possible. From a policy perspective, the lead here is the province. They're the ones who set in regulation and other guidance as to what can and can't occur, and often what restrictions there are. And these can sort of change rather quickly, and we don't necessarily have a heads up when that occurs. In terms of the overall approach, I mean, I think over the past 6+ months, we've learned what is effective to be able to prevent transmission, and it's shown here. And you've certainly have been hearing about this lately in recent weeks and months, in terms of the importance of distancing and staying 2 meters apart or 6 feet. The importance of staying home if you're unwell or sick. The importance of wearing a mask to reduce the transmission of respiratory droplets which carry the virus, and of course the importance of hand hygiene. So I'm just going to reinforce these, particularly in the context of recreation. And first off, we're going to talk about wearing a mask. As you know, Ottawa has a mandatory mask bylaw where people must wear a mask or a face covering when in indoor public spaces, and that the operator has a responsibility in a number of ways in terms of providing signage, to train employees on how to follow it, and to inform patrons of this bylaw, and of course making alcohol rub available. We at Ottawa Public Health have signage that can be utilized to fulfill that aspect of the bylaw. And as you know, there's a number of exemptions to the bylaw. This includes children. Certainly, it's not recommended that children under 2 wear a mask, and certainly children that are older than that or under 5 may have difficulty doing so, and may have difficulty being persuaded to do by the caregiver. So there's an exemption for that, as well as people with medical conditions or disabilities, including anyone unable to, for example, to put or remove a mask on. We also inform businesses that be cognizant, recognize that you may have clients, patrons who are hard of hearing and may require special effort on the part of staff to communicate with them. If they read lips or that sort of thing. But we say establish your 6 feet distance, and then it's okay to remove your mask and help the individual. Now, we've created this table, and of course, these slides will be made available to you afterwards, to sort of deal with some of the nuances and a lot of the questions that we've been receiving around wearing masks, of when you can or when you should or should not. In the masking bylaw, there is an exclusion when actively engaged in physical activity, and our guidance goes further on our website, talking about ideally you would wear your mask, for example, someone working out in the gym, up until the point where you're breathing heavily, or your heart's going up and you're just not feeling comfortable wearing a mask anytime further. But if you're doing lighter physical activity, we would recommend you still wear a mask, although it's technically not required under the bylaw. So as I said, this slide sort of breaks out in terms of situations of wearing a mask. So for example, while you're on the sidelines and not actively engaged in play, that you would be wearing a mask unless you're 2 meters away from the other folks on the sidelines, but that you wouldn't have to wear it while, of course, when you're playing. Similarly, for spectators, they would not have to be wearing a mask if they're outdoors and they're more than 2 meters apart from everybody else. But rather, if they're indoors, they would need to wear it, and certainly if they're less than 2 meters outdoors. So that this sort of breaks out some of the various combinations. Basic important piece of information is that whether you're an athlete, a spectator, or an operator and staff, you should not be coming to work when you're sick. This is a change in practice. We used to come to work because of a cold. No, that's not a good idea anymore, and we strongly recommend against it. And there should be screening practices for all your staff every day to make sure that people are not coming to work if they're unwell, as well as some other specific situations, like for example they've traveled internationally, and this should be being done every shift with staff as well as with team members. There's also signage that we have available on our website to have posted in your facility to reinforce this. We recommend that, in the instance that, someone develops COVID, that it's easy for us to identify who their close contacts were. So if they're coming to an exercise class or a team practice, that there's a record of who else was there and their potential close contacts. This will make it a lot easier to identify who else may be at risk of transmission, so that we can contact them. And so ideally they would have the date, the name of the person, and a telephone number so that we can contact them. And on our website, we have some templates to make it easier to collect this kinds of information. Also in the category of contacts and being able to identify who was my close contact, because that, after all, is how we're going to try and prevent further transmission, is of course the COVID alert app that was developed by Health Canada and is made available, and certainly encouraging people to have this on their phones, run in the background, in a secure way, communicates with other phones, so that if someone develops COVID, then there's the ability for the phone to identify those individuals who may have been in contact in the preceding 2 weeks, without identifying who they were in contact with. Again, distancing is really important, and is the basic one tool that we have. The most important tool that we have to prevent transmission is that maintaining that physical distance of at least 2 meters. Now, this gets a little more complicated, and some of our sporting activities, sometimes that bubble will be encroached upon. So if you're playing flag football and you're grabbing the flag, you're coming within 2 meters, or you're playing ball hockey and you're coming in to try and steal the ball away from someone. So there will be those momentary periods of where you're sort of entering your bubble, but then should be separating out. The provincial guidelines talk about reducing those opportunities for contact by taking a look at the rules of the sport and making modifications, and certainly that there should not be any prolonged contact, and certainly that those sports that by definition involve people having continuous contact with each other are not allowed. Things like wrestling and judo, for example. So I guess the other thing is that and this is going to probably come up throughout this session, is that many ways the people who know the sport best are in the best position to identify how they, what are the opportunities or the risks in that particular sporting activity where people can be coming into contact, and what can be done to reduce that occurrence. In terms of being organizing a facility and preparing the physical space, there are a number of things that one can do, and you see this in other businesses in terms of spreading people out in time and space, staggering schedules, limiting crowds, using visible markers, directional arrows, avoiding those kind of choke points at entranceways, to sort of have ideally separate entrances and exits, having hand sanitizer available to people coming in, and looking at the equipment and other space to design it in a way to ensure that 2-meter distancing. And while there's no specific number that can provide from a science perspective for high intensity activities where people will be breathing more heavily, then we'd be recommending more than a 2-meter distance between people. And if there are places where, particularly fixed points where people are interacting potentially less than 2 meters, to be considering the need for physical barriers. The gathering limits established by the province are, as you know, 50 people indoors and 100 people outdoors. And what I would stress is, just because those numbers exist doesn't mean it's feasible or a good idea to achieve them. The capacity of your space may be less than that in order to maintain that 2-meter distancing, because that's the actual driver here, is how many people can you have that are physically distancing in there. And so the 50 and the 100, those are maximums, but rather it's the distancing that should be the driver. As you know, the government changed their limits, and so instead of 50 people per facility, they modified it to be 50 people per room. But again, it depends upon the size of that room and its configuration and how it's going to be used in order to be able to maintain the distancing. There are some settings that where the limit of 50 doesn't apply, and those are listed there, such as pools and tennis courts. I'm not quite sure why you'd ever have 50 or 100 people on a tennis court, but nonetheless, that's what the government has identified. But at the end of the day, it's the 2-meter distance that's really important to maintain between people. And so this is sort of a joint responsibility to achieve this minimum distancing based on the characteristics of in terms of the flow of traffic and common areas, but then also as a coach or a leader of a sporting activity, to be able to design the use of the space to maintain distancing before, during, and after. And it's not just, and we've worked with some pro teams, and some of the plans we saw was really focused on, of course, on the training aspect in the early stages of the pandemic, and we said, and don't forget, getting to the facility or leaving the facility, that are also important. We've had cases, not necessarily sporting related, but in other kind of employment situations where people do everything right inside, but then they carpool, or they have lunch together in a car, or close at a table, and those are opportunities for transmission that one has to worry about as an employer or a facility owner. Leagues, as you know, the provincial regulations are that leagues can include up to 50 athletes and players, and that if you're more than 50, then you got to subdivide, and that the teams within those leagues can play each other, but are not to play outside their league. And really, this is around cohorting. So in that, if someone develops COVID, there's a limited number of other people who could have been in contact. So, closest contact would be with the team, and then limiting the number of other teams and other individuals that potentially could have been exposed. So that's the underlying rationale. Ideally, people are playing on one team, because the more teams that you're playing with on, then the more opportunity for exposure you have, as well as, if someone becomes positive, the more contacts they're going to have. So it's when, if you're playing on two teams, then it's not just that team and teams you've played against, but now it's the whole other team. So you basically doubled, in theory, the number of contacts and people you may have exposed. Hand hygiene. So early on in the outbreak, this was sort of at the top of the list of things to do to prevent. And I think over time we've recognized that it's other people that are the greater risk, but we still have to worry about this. Where we want to be having proper hand hygiene before and after each activity, or after we've touched things. And the key is, the risk is if we get our hands contaminated because someone has sneezed and touched something, we then touch that surface and then our hands contaminated. And we're not going to catch the infection through our hand, but it's if we bring the hand to our face and touch our eyes, our nose, or our mouth, that's the opportunity then for transmission. And so, the importance of frequent hand hygiene, limiting those opportunities for that transmission of those droplets or respiratory secretions, and limiting the customs that bring people close up. So that's more of a distancing thing. But of course, the handshakes, which we don't really do anymore, would be an opportunity for direct transmission of secretions from one person to another. The implication as well is for our surfaces that people are touching. And so really they should be cleaned and disinfected regularly between uses and at the end of play. And now some equipment is specialized, and so you want to check with your manufacturer in terms of how best to clean. Ideally, for things that are difficult to clean, that those are just removed, so that you're not going to be faced with how you're going to deal with those, and that people bring their own equipment, whether it's, as it says there, the yoga mat, the racket, or the towels. So you end up limiting the use of shared equipment and needing to worry about its cleaning and disinfecting. Overall, general additional advice as well is in terms of looking at your overall facility, where you'll have overall recommendations or guidance in terms of its cleaning and design, but then there may be facility specific or sport specific guidance, as well as provincial or national guidelines for a particular sporting body. The one thing I would flag about this, because I did take a quickie look at some of the guidance, and some bodies, and I've been involved with some in the past as a coach, and some are run on a pretty thin margin, others are much bigger and more robust. I would say some of the guidelines aren't up to date. And so as one's looking at those, one can always check with them to see if there's a more up-to-date guidance. But regardless of what's in the guidance, the importance of meeting the requirements that are identified under the Ontario regulations, which ultimately have to be applied. In addition to that, as it says there in the second bullet, is trying to minimize the amount of time people are there that can be avoided. So in other words, they don't get changed there. They come ready and dressed to play or be active, that sort of thing. Now, there's a lot to keep track of here and to follow the guidelines. And so our general recommendation is to have a lead person who is responsible for ensuring the guidelines are followed, who can say, hey, I'm seeing this, or I'm concerned about that, or I don't think we're doing this quite right, or we can improve here. So someone has that lead responsibility, and that all the requirements and guidelines are communicated to the relevant people, and that there's a plan for the safe return that's communicated and available to everyone. Staff and volunteers, this is new. Coaching, it's including this is new. So there needs to be training and discussion about how you're going to implement it in your particular context. having signage on the hand washing and the screening and the maintains of distancing and mandatory masks. And because these are higher risk activities, which is why they waited till stage 3, is to have a simple waiver or a notice of risk. In terms of resources, some of these are generic and are available in our business toolkit, and we have additional guidelines around workplaces and masks that you will find. Our sister public health unit to the east of us has a number of other pieces of guidance which may be relevant, and we will have guidance in these areas coming soon. And we are working with the Ottawa Sport Council, which helped assist us with putting this presentation together, and are in the development of a return to play roadmap, which I'm sure they'll talk more about, and of course provincial level guidance that you should be aware of. And some other resources are also available in the slide deck. So I'm going to stop there and also acknowledge, of course, Ottawa Sport Council and Marsha Morris and Kelly Bean from Citywide Sports in the city, who helped put this presentation together, and fortunately are here also to answer questions for the latter half of this session. So I'm going to stop there and turn it back over to Lynn, your moderator.
Great. Okay. Thank you, Brent. So let's dive into the questions, because we've had a few posted already and I'm sure more will follow. So our very first question comes from Christopher, and Christopher has asked, is the league aspect not specific to team sports? So Christopher, if you'd like to unmute yourself, perhaps you'd like to clarify your question a little bit, if you're comfortable doing so. So let's circle back to this question in a moment, and perhaps in answering some of the other questions that are following, Christopher will get the exact answer that they're looking for. So the next question, teams are limited to playing in one league. It is our understanding that individual players, however, can move from one league, cohort, or bubble to another without issue. Is this correct?
So technically that is correct. There is no limitation in the provincial regulations about that. What I would flag though is it does increase risk. It increased risk for that individual athlete, because now they have, instead of just their exposure to their team A, shall we call it, and the interactions with the other teams in that league, by also being part of team B, you've now exposed yourself to a whole other set of teammates and another set of teams that you're going to play in that league. So the net result is you're increasing your exposure, potential exposure to COVID. The other implication is that if you became positive with COVID, you've increased the number of people that you've potentially exposed beyond your initial cohort of a team to 2 teams.
Thank you. Our next question comes from Michelle. Michelle is asking, are change rooms to be avoided or closed?
So my understanding is that change rooms are now allowed. They weren't allowed at an earlier stage, but they are a more risky situation because you're not going to be able. Usually change rooms have limited space, and you'll have potential problems with distancing, and so that's why we recommend people come dressed to participate and would go home directly. That would be the safer approach to doing things.
Thank you. Our next question, they're asking for clarification on spectators within a facility. They've been notified that spectator numbers are separate from the participant number. For example, in an arena, there could be 50 participants and 50 spectators. Is that accurate?
I'll turn to a couple of my colleagues on the panel if they have an answer to that.
I can speak to that. So the provincial regulations do state that yes, the 50 participants can be separate from the 50 spectators. However, it depends on space, as Brent had noted before. The 50 is the maximum, and the space would be worked out by the facility that is hosting. So it may not be 50 total. And then in an arena, for example, the ice might not be 50 total. It is up to the facility to determine what those capacities are. And just to add to what Brent said about change rooms, this is the same thing for change rooms, that the capacities may not make it useful to be using those change rooms if you can only fit a couple of people into the change room. So that would need to be considered as well.
Also, can I add something else about outdoor sports? So obviously, outdoor is a different type of consideration for spectators. And so what we've seen a number of outdoor teams do if spectators are coming is to make sure, oftentimes it's the responsibility of the team management, be it the manager, be it the coach, to ensure that the spectators are aware that they should be practicing good social distancing. And usually if there is space around a soccer field, for example, or a baseball diamond or whatever, obviously the practical considerations of social distancing should be enforced. There's not necessarily the enforcement by the league because of the fact that it's outside. So it's the types of things that people need to be cognizant of if they are planning to attend, and there aren't fences to keep them out, for example.
So a quick follow-up question on that, and perhaps either Kelly or Marcia could answer this one. For indoor spectators, can spectators sit in their bubbles together as long as their bubbles are socially distanced from other spectators?
That's an interesting one because we can't control who is in whose bubble. Now, outside, obviously, it's a little bit different. Each indoor facility is going to have to come up with a plan as to how they're going to manage their spectators and where their spectators are going to be able to go, and whether or not they can have spectators. There's things like separate entrances and exits for the athletes and the spectators. So it'll be different at each facility. If we're going back to rinks as an example, there's been suggestions such as marking off spaces in the stands to encourage and show the 6 feet apart. Now there won't be anybody necessarily patrolling. Sorry, I don't know what that was. There won't be anyone patrolling for the 2 meters, but it'll be a good reminder to people coming into the facility, such as the other markings that we have in the facility about staying the 2 meters apart.
Okay, thank you. Our next question is regarding swimming pools. The question is, it's noted that swimming pools are exempt from the 50 ruling. What is the guidance or recommendations for swimming pool capacities? Who is best equipped to answer that question?
Hi everyone, it's Jenny Queen. I'm also with Recreation and Culture with the City of Ottawa with an aquatic background. For swimming pools, your best option is to follow the guidance put out by the Life Saving Society of Ontario, and I will add that link to the chat for everybody. It again is following the basic principles of 2 meter distancing. So it's going to vary depending on the type of activity that you're hosting in your pool, whether it be lane swimming versus an open public swim versus participating in water polo, synchro, those types of things. So I'll post the link to the Life Saving Society where you can find the best information on that.
Thank you, Jenny. Our next question, Sienna has a client with a chronic cough, not related to COVID, and the client is taking medication for it. She'd like to continue taking fitness classes at this business. but Sienna's not sure how to deal with this since having a cough is a symptom of COVID. Should people with prior conditions be allowed to attend classes?
So built into the screening tools are around new or worsening symptoms, or if there's the alternative explanation. So the simplest thing would be the person with a runny nose. It happens every time this year because they have a ragweed allergy, and it's similar to what they've had before, and it's so in that way it's not new. And so that would, in other words, be okay. Similarly, if the person has a chronic cough and it's not new or worsening, and they don't have any other symptoms, then that would also be okay.
Okay, great, thank you. This question comes from a dance studio. If a student becomes ill and tests positive, do all the participants in that class need to isolate for 14 days?
So public health, Ottawa Public Health would work with, in this case, the dance studio and the person who's the case to have a sense as to were they communicable, were they infectious while they were at the studio? And if so, who was in close prolonged contact with them and would require self-isolation and recommended for testing. So ultimately Ottawa Public Health will advise on that, and that's where it's really helpful for you to be able to know, so say Janet is the person who's positive, and we figure out that Janet was infectious in these two classes. Who else was there, so that we can contact them, and we would divide them into high risk or low risk or no risk, and then we would follow up with them appropriately.
Excellent, thank you. Next question, are coaches and team volunteers included in the league number of 50, or is that number specific to the players?
I'll turn to my sporting colleagues in a second. My understanding is it's included. Kelly or Marcia?
My understanding of the provincial guidelines is it is not included. It's separate, but I don't know if they go as far as team volunteers. It says coaches and officials are separate within that 50. But again, Ottawa Public Health, I've seen your recommendations that we don't encourage the coaches and volunteers to leave that bubble of 50. So if they coach in that bubble of 50, they don't also coach in another bubble of 50. And then just one more comment on that again, it's up to the facilities and to the sport organization to determine. They can go above and beyond the provincial recommendations. So they could include the coaches and team volunteers within that bubble of 50, and we have seen that as well.
I think the other thing that's important to note is most organizations have, yes, they have to follow the OPH guidelines, they have to follow what the City of Ottawa is saying, but all of them also have to follow what has been mandated and sanctioned by their national sporting organization, their provincial sporting organization. So in some cases, those specific organizations have talked about specific numbers as well. So it's up to them to understand if they're undertaking a sanctioned activity by their sport, that they're following the recommendations and the guidelines from their sport as well.
Marcia, just to follow up on that, if a sport organization has a national association and a provincial association, and they're also getting guidance from the provincial government and from their municipal government and their local health authority, who trumps who in terms of, who's the ultimate authority for them then?
The ultimate authority would most likely be the number that is the lowest for safety perspective. So at the end of the day, and that's what the Ottawa Return to Play Roadmap is all about, and that's what it says. So at the end of the day, the community sport organization has to put together, has to marry those recommendations and requirements. But just like in Canada, we have all the different provinces and all the different regions who all have different numbers. Even within the province of Ontario, we've got different regions who have different numbers. And so the required number to follow is by far the one that is the lowest, because of the fact that it's the most safe and it's the most cautious, and it's been put there for a certain reason, be it a geography reason or be it, so for example, in rugby, are you going to put that many people so close together when it's a very contact sport versus if you are cycling and everybody is, 2 meters apart already, you could put far more people together. So it really is about marrying all the different requirements and going with the lowest one because it's the safest.
I can add to that as well. I've worked with a lot of groups on their reopening plans within the City of Ottawa, both within our own facilities and non-city facilities. So as Marcy said, there's a lot for groups to look at. The regulations that come out from the province, which they must follow, the public health guidelines, which they must follow, and then the sport guidelines. So sport guidelines, if it's a sanctioned sport participating under, I see Hockey Eastern Ontario is on the call, or Basketball Ontario, then they must follow those guidelines as well. But then we have a lot of recreation facilities, or boys and girls clubs, or other non-sanctioned sport activities that are just looking for some guidance. So in all of those areas, we would direct them to the provincial sport organization, because they've developed great plans for return to play. And Marcy spoke to the return to play roadmap, and there's lots available on the Ottawa Sport Council that connects all of those different return to play. But in those instances, those are resources. Those community groups would be following their public health as well as the provincial regulations, and using everything else as a resource.
Thank you both. I think that really clarifies the issue. Thank you. Our next question comes from, whoops. Oh, I did miss somebody's question, Valerie's. I'm so sorry. I'll scroll back upwards. Oh, here we go. So Valerie's with TD Place, and she's asked, should we mandate that renters follow the approved guidelines of provincial sports such as Ontario Soccer? So they're going to be renting out their field at TD Place. So I'm guessing, Valerie, that she's asking, one day they may rent it to a soccer team and another day they may rent it to field hockey. So who would be the authority there? Kelly?
I can speak to that as well. So within the City of Ottawa, our allocations team has updated our terms and conditions for anyone renting our sports fields, ball diamonds, arenas, anything like that, to ensure that they have a return to play plan for whatever they're renting for. So in most cases, it makes sense for that sport to refer to their provincial governing body that can help them with that return to play plan. So soccer, to look at Soccer Ontario. But what we're asking is how is this specific group that is renting our field using the Ontario Soccer guidelines, and what is their return to play plan? So Valerie, in answer to your question, you could say that they have to follow the provincial sports plan that Soccer Ontario put out, but I would recommend that you're looking for even more. So at that level that is renting your facility, to update your terms and conditions to say that they have a return to play plan that adheres to public health guidance, provincial regulations, and that is informed by your provincial sport organization.
And further to that, thinking about it, in a lot of the OSA plans, they'll talk specifically within the plan about you have to follow your local health authority. So doing that marrying, whoever the organization that's coming in needs to marry what the OSA plan is in conjunction with the City of Ottawa Public Health Plan to make sure, as Kelly said, they have their specific return to play plan that's customized for the city that follows OPH's guidelines.
Great, thank you very much. Next question is from David. If a person tests positive but they're asymptomatic, is it correct that they are supposed to self-isolate for 14 days and then get tested again? And if so, what happens if they still test positive after 14 days and are still asymptomatic?
I'll take that one. So thank you. There's a fair bit there. So regardless of whether the person is symptomatic or not, if they test positive, then they'll need to be in self-isolation for 14 days, and have been, symptom-free at the end. There is no need for retesting. There's no need for test of cure or clearance. There was recommendations for some groups at the very beginning of the pandemic to do that. Our experience is that we end up picking up chunks of virus. It's not viable virus, it's pieces of virus, but the test picks it up anyways, and that can go on for weeks, and some days it's there, some days it's not. So really it's the 14 days that is critical, and public health will, if you test positive, we will be in contact with you and review things, and we'll tell you when you're able to return and when you start counting the 14 days, because it depends on the situation.
Thank you. Our next question comes from our friends at Golfomax. Golfomax Indoor Golf Center, they have 11 golf simulators separated by partitions that are over 6 feet high, and tables at each simulator are 12 feet apart from center to center. Groups usually play in foursomes or threesomes. And then, oh, there we go. There's the rest of the question. What protocols would they need to follow? Anybody want to take a stab at that one?
Brent, I think I'd defer to you on this one because it's more of a indoor public health guidelines rather than like following the return to business plans from public health rather than a specific sport.
Yeah, and I think
I've unmuted in case you want to.
Oh, thank you, Drew.
Yeah, no, I mean, just trying to listen through and think. I mean, I think it would be more of a conversation in terms of understanding what the process is here, to be able to give you a definitive answer. Because you're talking about groups, and so then we're going to get into, are they all part of the same household or social circle, use of masks if you're indoors, and then the issue of distancing and hygiene. So it's really sort of applying those principles of masking, distancing, and hand hygiene, and worrying about any shared surfaces or equipment that they'd be using, including the whether you're touching something on the simulator in addition to the clubs and whether they're your own or not. So I think it would just be, you won't have to work through all those details, and that would be part of your return to play plan. Certainly the guidance on the website would be a starting point, and then you could certainly say, send us some questions of clarification that we can then help you out with.
And which website would that be then?
That would be the Ottawa Public Health website.
Okay.
That's what I was going to suggest as well. In the city is building all of our return to play plans for sport. We build them based on all of the guidelines that are already available, the provincial regulations, the Ottawa Public Health guidelines. There's lots available on Ottawa Public Health website. And then if we hit specific questions that you can't find on the website, then there is a channel, and maybe Jenny can chime in here about how to submit specific questions. But most of it, if your question is related to cleaning, there's already information. If it's related to groups and physical distancing and space allocation, there's already information on the public health website for those.
Okay, we also serve food and beverages at the simulators. We have a lounge as well. Probably we would limit the amount of people in the lounge, obviously, like restaurants would have to do. So we've got questions on that as well.
Yeah, so again, on our website, there will be information around in indoor dining and food courts. It sounds like it's more the former than the latter. And so there's information on our website in terms of guidance around that. And again, when you've had a chance to look through that, if you have any additional questions, then you can certainly send those to us.
Drew, we did a workshop, I think just a couple of weeks ago, on restaurants and indoor dining. I'll make sure that you get the slide deck from that, and you'll also be able to watch that recording online on our website.
And one of our staff just texted the two relevant websites, one for food establishments and one for sports facilities.
Thank you, Crystal.
Okay, thank you.
Is that good, Drew?
Good for now, yeah. Thank you.
Okay, thank you. We have a question from Kate. It was mentioned that coaches should wear a mask at all times indoors. On an indoor tennis court, if a coach is at one end of the court instructing players from the other end and are more than 6 feet apart, would the coach need to wear a mask?
So my initial reaction is it would depend a little bit on whether the coach is playing it in. Like in my personal experience in tennis facilities is often the coach is playing in. And so depending on that level of activity, they may not be able to wear a mask, and that fits under the exemption. But otherwise, that's an indoor facility. And the distancing doesn't apply because it's indoors, and so the masking bylaw would apply. Kelly or Marcia, in your experience, is there anything that would be different from that?
No, we've used the same examples when responding to questions from our sport groups, that if an athlete is engaged in play, then they wouldn't need to be wearing a mask. And we've used the same wording for the coaches. If the coaches are engaged in play, moving, skating, we've looked at this for our public skating attendance within the city. If they're actively moving and engaging in play, then it isn't required that they wear a mask. But if they can and they're comfortable wearing a mask and they're not physically exerting themselves, then we would still recommend that they wear a mask. In our indoor tennis facilities specifically, all of the staff and coaches would wear a mask unless they're actually playing. So the coach, I've seen coaches stand on one side of the tennis mat just feeding balls. Well, in that case, we'd probably recommend that you still wear a mask, because then they're also giving feedback and probably approaching participants at the net. But if they're standing back and they're playing, then they'd be actively engaged in play and they wouldn't be required to wear a mask. But the overall message, I think that Brent has been saying too, is if you can, then wear one. And if you're engaged in play, it's not required.
We've seen mostly outdoor up until now. So most of the activities that we've been involved with have been people that are outside. So when approaching the facility, coaches are wearing a mask, but once they get into the field of play, then they've been taking their mask off, regardless if they're actually participating or instructing, because often outside it's very difficult to hear when somebody's got a mask on when you're trying to communicate. Obviously the indoor thing is going to start happening quite soon as we all start moving indoors.
And just one more point that Marcy brought up earlier, that the return to play plans from individual sports often will speak a little bit more to this. So tennis may have something within their return to play plan that speaks to what their coaches should or shouldn't do. I know, for example, Baseball Ontario has regulations in place where if a coach approaches a pitcher on the mound, they put a mask on, because usually it's quiet conversation up close. So sometimes the sport will guide it a little more as well.
Yeah, no, Marcia, Kelly, thank you very much. Those are great examples. And going through my mind is basketball as well, where, coach may be on the sidelines, but then as they come into the practice court and they're talking to the players, and we're going to have distancing issues, or they might be, showing players how to properly position themselves. You really, from a transmission prevention perspective, really want that coach to be wearing a mask.
Excellent, thank you. One more question has come in. This is an interesting one. For outdoor running or cycling events, they usually have mass starts. Would simply starting the group spaced apart be safe enough, or should each individual start separately? Kelly, do you want to start with that one?
That is an interesting one, because the provincial government has only spoken about individual competition as being allowed. There hasn't been any, as much as there's been some additional guidance for team sports, they've been really lacking on the regulation aspects for individual sport. So for those two, I would refer you to your sport governing body to look at what their guidelines and suggestions are. I'm not familiar with the outdoor running or cycling event. Just in terms of individual activities, we've looked at those. I don't know if Marcy has more to add for events.
Yeah, so for pretty much the very first event that happened was last weekend in Montreal at Parc Jean-Darclos. They actually did a try and they seated people in groups. So they had to do it all obviously in concert with the Quebec government and public health out of Montreal. They seated people in groups by your timing, what you thought you were going to, you know, your previous times, and they were setting people off from the running event in groups of 6. So in order to, I mean, for an event that usually is extremely oversubscribed, they had 400 people participating, but again, it was the first mass event. But they had to work very, very closely with City of Montreal's public health, and they had to work very closely with the province of Quebec. So I wouldn't be suggesting that we're having any mass events right now. And obviously, if something of that's of interest, like Kelly, I'm not really too sure that the Ontario government has provided any guidance on that because of the thought that, you know, whether it's approved or not at this point in time, but it's something that would have to be done in concert with both the government and Ottawa Public Health, obviously.
I would expect the logistics for organizing that would be incredible.
Well, I think the other thing is therefore it becomes the cost of organizing it. And you know, the benefit of Parc Jean-Darclos is that it's a self-contained area on the island. So they're not shutting down a whole bunch of different roads. It's a, you know, it's in a bubble by itself almost. But in order to do something like that in the city of Ottawa with the road closures that you would have to undertake, I don't know that financially it would even be feasible at this point in time.
It's a great point. And one of the things we did some thinking about, because we had some earlier questions around a biking and a running event. And, you know, so you've got, you know, in the case you gave, you know, 6 people starting, but then you got to have the next 6 ready and spaced out. And then the next 6. And so even with these staggered starts, you've got to do a lot of organizing behind to have them all registered and ready and spaced to go. And yeah, the logistics and the space requirements are big. And then you have to worry about the congregating at the end as well. So it's a big undertaking in this environment.
Great. Another question, is there anything to watch for in regards to sports with balls being exchanged and touched? This question is coming from a table tennis club. So should they be washed, wiped down? Do you have any specific guidance for them?
My initial, I'm going to turn over to my colleagues in a second here. I mean, it's going to depend a little bit on the sport and the nature of how that ball or balls are dealt with and what the opportunities are. And I'd be looking to the individual sports organization to provide the guidance. Because what you would do in basketball, where you're handling the ball, and there's only one ball for the teams, is going to be different from something like tennis or table tennis. Kelly, Marcia, would you have anything to add?
I think it's also exactly as you said, you're going to be getting recommendations from your provincial sporting organization. But I think the other thing that's very important to note is, just as you said about COVID testing, you know, where at the beginning we used to test at the start and then, you know, 2 weeks later, obviously as things change within what we know, those recommendations are going to be changing as well. And so what might be, you know, appropriate now might not be required in about 2 or 3 months. I know, and Kelly can probably speak to the tennis example. When tennis first started, it was recommended that everybody have their own balls and you were only using your own balls. I'm not too sure if Tennis Ontario has updated that now, and that, you know, you can use the same ball, both parties can use it.
Exactly that. The provincial sport organizations do speak to this when there is shared equipment for that particular sport. So tennis has evolved. You're correct, Marcy. It used to be that players brought their own ball and equipment and you didn't touch each other. They even went as far as saying mark them. So on the tennis court, you would know the ones marked by X belong to me, and the ones that didn't belong to my partner. They've changed their requirements just to say that, you know, ensuring that there's hand washing, and just ensuring that they're playing not with too many different partners, that kind of thing. So even in the lessons now, it used to be that kids couldn't help clean up the balls, and now they are allowed to do that under Tennis Ontario guidelines. OPH has a lot of good guidelines in terms of what cleaners to use and how to clean, and if surfaces are more porous and you can't clean it as easily, how long you should be leaving that piece of equipment before the next person uses it. Lynn, I don't know if you can speak to the FAQ and to share some of these questions and more information that will be shared with them, because the cleaning goes into a lot of detail. And then if we share the FAQ, it would be shared with everybody.
Absolutely. I'm happy to distribute anything that you'd like shared with our audience today.
So there's lots more for the cleaning, but it's all on that FAQ.
So we have time for the last two questions that I see in the chat. Christopher had asked about whether or not there's signage available for people who are organizing events. I see that Crystal at Ottawa Public Health has already posted a link with respect to that. Excuse me, but Kelly and Marcia, I'm wondering if the sports organizations have their own signage available?
So on the Return to Play roadmap, we have some example of signage, and we also have a contact that a number of sport organizations have used for signage. Again, the whole purpose of the roadmap wasn't to reinvent a wheel. So anything that Ottawa Public Health had come out with, we are recommending people use that. There's no need for your own specific, you know, the mask signage is enough, the wash your hand signage is enough, that, you know, there doesn't need to be specific signs. In some cases, there's specific signs required for ingress or egress of a specific facility, so you need to do your own. But in most cases, the information that Ottawa Public Health has shared and that's out there is very appropriate and valid, and there's no need to require it to do anything further than that. Excellent,
thank you. Our final question, if change rooms open, what would be recommended for shower facilities? Should these be closed for use, or would it be just recommended to disinfect regularly as the bathroom and other high-touch surfaces are?
It's the same issue with the change rooms in terms of limited space, high-touch surfaces. Ideally, people are showering at home. But you know, if and when they're open, then it's going to be an issue of spacing, good hand hygiene before and after. Don't be touching your face unless you've got cleaned your hands.
In many cases, change rooms aren't opening because if people are in the change room, they're considered numbers within the facility. So a facility doesn't necessarily want to have 10 of its numbers in a change room. So they're not opening their change room so that their field of play can be most effectively used, and, you know, they're not losing people. They don't have to account for those people and say, oh, now I can only have 40 people in the field of play because I've got 10 people in my change room. So the change room opening, a lot of cases, well, the safety is absolutely a concern. It's also about, it takes away from the numbers that can be in the field of play, which is why we all want to attend a sport facility in the first place.
Just one last point to add there, that we're talking about athletes arriving and leaving. So they arrive dressed, they play, and then they're not hanging around afterwards. So this is often why, again, the same as Marcia was saying, that we encourage people to shower at home. Many facilities for organizations that I work with, they're opening for washrooms only, but their showers will be closed. Water fountains will be open for water bottle filling only, but not the drinking spout. So it's also about the number of touch surfaces. So Amelia, I'm not sure what organization you're with, but it is ultimately up to you. But if you're looking for what the recommendation is, the recommendation is typically that you move people through quickly, and that's why we would be closing the shower facilities.
Thank you. So that takes us to the end of our session for today. I want to thank, of course, Ottawa Public Health and Dr. Brent Moloughney and Crystal and everyone else from OPH that's on the call today. I'd also like to thank Kelly Bean and Marcia Morris for joining us today. Thank you so much for supporting Ottawa Public Health. And a reminder that the recording of this session will be on our website sometime later this afternoon in case you still need to watch it, or if you'd like to share it with your colleagues. And we'll also be circulating the slide deck from today so that you have that. And any of the links that were posted in the chat, we'll send those out for you as well. If you have questions that come up that were not addressed today, you can send them to me. I will do my level best to make sure that you get a good answer. Everybody is invested in your safer reopening. So on that note, I will thank you for joining us today and have a lovely afternoon. Thank you very much, everybody.
Great. Thanks, Kelly and Marcia, very much.
Thank you very much.